A raft of health-related bills in Kenya's parliament aimed at improving healthcare delivery remains stalled or delayed, raising concerns about coordination, duplication, and missed opportunities in achieving universal health coverage. Let's take a look at what's slowing down these critical legislative proposals and what legal experts say needs to change to fast-track reforms. From maternal care to cancer treatment, Kenya's lawmakers are grappling with over a dozen pending health bills, many of them well-intentioned but trapped in legislative limbo. According to constitutional lawyer Charles Kanjama, while generally the health bills are well-intentioned, the legislative efforts appear fragmented with growing concerns over the lack of clear coordination.
It's not clear whether the Ministry of Health has participated or been involved in the drafting of these bills, whether they have given their views about these bills. And so you'll find that there's a sluggishness by the government machinery in Parliament, which is given priority through the standing orders for government business to adopt some of these bills.
Among the bills stuck in process are the Community Health Services Bill, the e-Health Bill, multiple versions of Cancer Prevention and Control Amendments Bill, multiple versions of the Health Amendment Bill, Breastfeeding Mothers Bill, the Medical Social Workers Bill, the Tobacco Control Amendment Bill, the Kenya Health Products and Technologies Regulatory Authority Bill, Human Tissue and Organ Transplantation Bill, the Maternal, Newborn and Child Health Bill, and the highly debated Assisted Reproductive Technology Bill. According to Kanjama, most of these bills are private member bills sponsored by individual MPs and senators, not the government, that puts them at a disadvantage in terms of priority.
One of the challenges with private members' bills is they deal with small sections of the sector. And sometimes there might be two private members' bills that are a bit inconsistent or maybe even contradictory, and sometimes they may need to be consolidated. So for individual members, they have to do a lot of lobbying, both to persuade their fellow members in the House to support the bill, and also to persuade the House Business Committee, whether it's for the National Assembly or for the Senate, to prioritize the bill.
Some bills, like the one on assisted reproduction, are also raising moral and constitutional questions.
There are some sponsors or stakeholders who are pushing for certain things, whether it is in vitro fertilization or surrogacy or those kind of assisted reproductive technologies. And you have other sectors of the population, including churches and religious people, Muslims, etc., who may have concerns with some aspects of those bills. So they are raising moral questions.
Kanjama stresses the fact that Kenya's legal landscape remains strikingly silent on matters of assisted reproduction, with glaring gaps that have even been flagged by the courts. The country currently lacks legislation governing critical aspects such as in vitro fertilization, IVF, and surrogacy, leaving both medical practitioners and prospective parents in a legal grey area.
Kenyan Constitution says life begins at the moment of conception, which we take to mean fertilization. So if life begins at fertilization and then a couple have come up, their embryos created, and then they decide they don't want to have them implanted so that the process of conception doesn't take place, then what happens? So there's clearly need for regulation.
Others, like the Kenya Health Products and Technologies Authority Bill, propose new institutions, a cost burden Kanjama says should be reconsidered.
Private members' bills in general should not recommend setting up of new institutions unless they have done a lot of groundwork that involves treasury, that involves finding out what is the costing of this new institution. In fact, that makes the bill become like a money bill, because now you need money to implement this bill. When it is possible to set up an institutional framework that is within the line ministry, it is definitely more economical and better than an independent institution. Independent institutions have their merits, but generally should be set up when the government is fully part of the journey of lawmaking from the beginning.
Despite their slow progress, these bills are essential for Kenya's health future. But according to Kanjama, they must align with constitutional requirements, especially with the health being a devolved function.
Any bill that is touching on healthcare professionals, regulation of professionals, the Supreme Court has said, is a national government function. It's not a matter concerning county government. If it is just policy issues, it's national government function. But if it is impacting healthcare facilities, that means the county hospitals will be impacted, and that's a matter concerning county government. So if this is taken into account by those involved in making these laws, and they ensure that where it is a matter that might involve county government, they go through the concurrence process of getting the Speaker of the National Assembly and the Speaker of the Senate to confirm whether it's confirming county government, it's concerning county government, then they will avoid the risk of the acts or the statutes being struck out because of not having followed the dual legislative process or bicameral legislative process that is prescribed for matters concerning county government.
Kanjama says greater collaboration among MPs, ministries and the public is critical.
Kenyans need to know that it is a constitutional right that they have to participate in the lawmaking process. They should look out for advertisements that come out about bills. They should review the contents of bills. They should send their memoranda or recommendations. In the occasions where public sittings are organized or town hall sittings, they should attend, give their views. They should consult experts in areas of health so that they can also give informed opinions and not just opinions that have not been backed by information.
As Kenya continues its journey towards realizing Vision 2030 and achieving universal health coverage (UHC), the legislative process remains a vital cog in delivering timely health reforms. Kanjama has outlined the intricate journey a bill takes from proposal to law, a journey that can significantly impact whether the country meets its national health goals or falls behind. The first stage of lawmaking is to come up with a legislative proposal, which is then tabled in Parliament.
It can be tabled in the National Assembly or the Senate. The only bills that are tabled in the Senate are bills concerning county government. All other bills have to be tabled in the National Assembly and can only be dealt with in the National Assembly. But a bill concerning county government can be tabled either in the Senate or the National Assembly. Those bills concerning county government have to pass through both houses of Parliament. But all other bills only pass through the National Assembly.
Once a bill is introduced, it goes through 3 readings. The first reading is largely ceremonial. Only the title of the bill is mentioned. The second reading opens the floor to substantive debate on the key provisions of the bill, after which it is referred to the relevant departmental committee.
They do public participation, they receive a report or they prepare a report after getting views from Kenyans and other stakeholders. They can recommend changes. Then they report to the House.
These recommendations are brought back to Parliament during the committee stage, where proposed amendments by either the committee or individual members of Parliament are debated and voted on. This culminates in the third reading, during which MPs vote on the final version of the bill. At this stage, the bill can pass or be rejected.
So for bills which seek to amend the Constitution, they need a 2/3 majority. But for all other bills, they just need a simple majority of the members present and voting in the House.
If the bill concerns both houses of Parliament, it passes through each chamber, either in identical form or through a reconciled version, after which it is forwarded to the President, who has 14 days to assent to it or return it with reservations.
If the President objects to part of the bill, then Parliament can either override his objections with a 2/3 majority, accept his rejections or his revisions, or the bill fails. And if the President approves the bill or fails to act on it for 14 days, the bill becomes law.
With the legislative machinery playing such a vital role in shaping Kenya's health future, The direction Parliament takes in the coming months could determine whether Kenya lives up to its Vision 2030 health promises or risk losing momentum on critical reforms. For Willow Health Explainers, I'm Nuru Abdul Aziz.